This exercise is called the posterior hip glide, the back side of the hip glide. Doesn't that even sound wonderful? So the goal of this movement is to stretch out our hip capsules. Yeah, our hip capsules. So joint capsule, think hip joint, which can help your hips feel looser and decrease the tension in that lower back. Especially when we sit a lot, the back side of our hip capsules can get pretty tight. So this is gonna help open that up. So what you're gonna do is go ahead and get into a hands and knees position, okay, if you can. And place pillows under your knees if you have to. But what you're gonna do is make sure your knees underneath your hips, hands underneath your shoulders, swing one foot in and place the other knee behind that foot, right? And go ahead and place your elbows on the ground or keep your legs straight. And just gently, right, shift your hips back into the side. And you're gonna wanna feel the point of pressure and tension in that hip area, the top of that hip. And by mean tension and pressure, like a stretch, okay? This isn't a pigeon stretch, even though it may look like getting into it if you do yoga of any kind, but it's really for the back side of that butt. All right, so again, swing that foot in, place the other leg, knee behind the foot, elbows on the ground to really feel the stretch in the back side of that butt. Shift your hips like 1 to 2 inches back or to the side to really feel that back side of the body opening up. So if you're in a wheelchair of any kind, what you can do is take your hand and push, so grab onto your knee and kind of pull the knee towards your butt, right? So think about like almost like shifting. If you can, shift your hips back if you have the ability to do that, or use your arms to pull, and or a towel or a band of some sort, pull that knee back towards the butt. So you're getting a nice stretch there. If you have any lower extremity limitations, there's really no changes here. Okay, you just might you might take your prosthetic off. If you have an above the knee amputation, you might not even need to do this on the prosthetic, the amputated or salvage side. Right, focus on the other side. But if you're able to keep your prosthetic on or salvage or orthotic on, do it. With the upper extremity limitation, there's really no changes here. You might want to just support the arm with a bolster if you're in the quadruped, this hands and knee position. Invisible wounds, take your time going to the ground. Keep those eyes and heads fixed on a non-moving and non-distracting background. Enjoy, this one is really awesome. It may take you a minute to get it, but have the patience. Okay, and spend, if you can, 90 seconds to 2 minutes aside on this. Enjoy.